we are continuing a very important conversation. I think we've spoken about this quite a bit on the show.
Yeah.
But now and again you hear stories and it compels you to come back to it again because, of course, it's a learning process. It's not a journey, right? So you have to learn, and there's more additional knowledge coming. There are more, different theories and research coming in and all of that. So today we are looking at diabetes, and for a lot of people, when it's mentioned, the first thing is like sugar level.
Yeah.
Sugar level is like the correlation, like diabetes, sugar.
Exactly. That's true. That's true. When you talk about diabetes, usually people think about sugar and its effect. But basically, diabetes has to do with you looking at taking a little bit of your blood and then looking at the sugar levels within that blood. Okay. So usually we would say that there's something, anytime you eat, okay, the food goes through digestion. So it goes through digestion at various stages in your digestive system. So from the mouth, it goes all the way to the esophagus, and then it goes into your stomach. So at every stage, there's some level of digestion. And the end product is basically glucose or sugar, which will then be within the blood, okay? But then this sugar that is within the blood needs to get into your cells. So your body is made up of different organs, and these organs are made up of cells, okay? So how does the sugar that is within the blood get to the cells? You need a hormone. So that hormone is produced by the pancreas, which is called insulin. Okay, so that hormone, what does it do? Basically, it helps the sugar that is within the blood gets to the cells, so that the cells will then use that sugar to produce energy that you can now use as a human being in a whole. Okay, and then also to help with your repairs and whatever within the cellular state or cellular level. Now, when we say somebody has diabetes, it means that there is some defect in the function of the hormone that I just mentioned, which is the insulin. It means that the insulin is either being produced, but there's some resistance, so it's not functioning optimally the way it should, such that now you have the sugars within the blood, but then it doesn't get to the cells where you need them to function. Okay, so I always say starving in the midst of many. That is basically what diabetes is. And certain people also do have a problem with even the production of the insulin, or there are certain autoimmune conditions that will affect the pancreas such that you can't produce the insulin for it to do the work that I have mentioned. That is to help to redistribute the blood that is within to redistribute the sugar or the glucose that is within your blood, so that it gets to the cells for it to be used in the production of energy that is used subsequently. So that is what really diabetes is. And it's quite common because sometimes it tends to affect a lot of people. It's one of the non-communicable diseases. And people, there are two main types of it. You have the type 1, you have the type 2. The type 1 is basically the autoimmune type, and then the type 2 has a lot to do with lifestyle. So it has to do with what are we eating, what are we sensitizing our bodies with. Are we eating a very high carbohydrate diet? Are we eating diet that is greasy? Are we eating diets that does not contain a lot of fruits and vegetables? And all of these would affect the sensitivity of your insulin that is being produced, and eventually you may end up with diabetes. That is the resistance to the use of the insulin that will help with redistribution of the glucose that is found within the blood. And patients who do have diabetes sometimes may not even know until some of the dire complications have happened before they get to know. So it's important that we mention a few of the signs and symptoms that is associated with it. And I must just quickly add that November is actually the World Diabetes Month.
Oh, really?
Yes, where, 14th is usually the day, but within the month, healthcare professionals take the opportunity to talk about it and then to sensitize people about diabetes so that they don't end up, they refine their knowledge and make sure that they're on top of their game when it comes to diabetes and how to prevent it. So what are some of the signs and symptoms that I started talking about? So usually you would say that sometimes there may not be any signs and symptoms, but at the initial stages. So the only thing that may help you would be to go and then have a test done. Once you do the test, you would be able to know that, okay, I have these sugar levels that are beyond what it should be. Then you can do further tests for you to be able to know if you're diabetic or not. Certain times, the overt signs and symptoms associated with diabetes are something we call the P's. That's polyphagia, polyuria, polydipsia. Okay, those are the main signs and symptoms associated with it. So you notice that people are peeing a lot. Okay, so the volumes of their urine is quite huge. People are drinking a lot of water. I'm sure the questions that will come to me will be, hey, so if I start drinking a lot of water, does that mean I'm diabetic? Yes. But then you don't take these signs and symptoms in singles. You have to put them together before you can make that diagnosis. And people may end up, the polyphagia means that you may end up eating a lot, okay, than usual. And then unexplained weight loss, okay, could be one of the symptoms as well. Unexplained weight loss and then general malaise together with these. And then when it becomes complicated, you may end up having certain signs and symptoms that may affect your eyes, so you may end up with some blurred vision. Some people have inability to, where anytime they get a cut or anytime they have sores, it becomes very difficult for these sores to heal. Okay, it's all part of the complications because of the effects of the sugar on some of these cells, and it reduces your immunity in general. Okay, so these are some of the signs and symptoms associated with diabetes. Certain times people may not be able to tell, but they notice that I haven't, for the past few months, I've noticed that I'm eating a lot, but I am losing weight. I'm continuously, I'm actually losing weight, and I tend to become hungry in no time. Okay, so that is one of the things that may prompt you to want to go and then have a check. And other times you notice that people would say that anytime I wake up early in the morning, I feel aches all over. Okay, so all of these signs and symptoms, if you haven't checked your sugar within this month, take the opportunity to go and then have a check of your sugar. So how do you check for your sugar? I've seen pictures on our screen so far showing that they are checking their blood sugar levels. Okay, so we have different types. We have the fasting blood sugar, we have the random blood sugar, and then we even have the OGTT. And you can also do your HbA1c, which is more sensitive. Okay, so what do we say when you say fasting blood sugar? So this is when you check your blood sugar level after fasting for at least 8 hours. Okay, so if you have fasted for about 8 hours, and then we take a blood sample, usually take your capillary or take your venous, and then you check the blood sugar levels. Yes, that is what makes it fasting blood sugar. Usually would say that if you have a fasting of about 7 and above, then it means that with symptoms of some of these symptoms that I have mentioned, then it's likely you have diabetes. Okay, when it comes to the random, it means that you can take it at any time when you have eaten. And if you have a value which is about 11.1 and beyond with symptoms that I have mentioned, that's also maybe diagnostic of diabetes. And then you have your HbA1c. If you do measure it, that's would help you know the glycemic control over 3 months, 2 to 3 months, because it's much more sensitive. So if you do have that, then it means that if you do have a value of 6.5 and greater, then that can also be diagnostic of diabetes. So these are some of the tests that are available, readily available, that you can do to be able to tell if you are diabetic or not. Really, the type 2 has to do with lifestyle. Okay, it has to do greatly with lifestyle. What am I eating? Am I eating right? Am I exercising? Am I making sure that I don't take a lot of refined foods? Am I incorporating a lot of whole grains in my meals? And then incorporating some fruits and vegetables in my meals. That is also very important. And mind you, diabetes and hypertension are like brothers. Okay?
Yeah.
So diabetes has the potential to put you at risk of developing hypertension, and then the vice versa also happens. And all of these are non-communicable diseases which we should be able to control as much as possible once we do have the knowledge, and so that we don't end up contracting or getting these diseases. And more so, even the most painful is getting the complications that may be very, very serious.
When we talk of lifestyle diseases, more often than not, so I mean, stroke, heart diseases, obesity,
non-communicable diseases, you know, so you put them all
together.
Under, yes, NCDs or non-communicable
diseases. Will you say amongst all of them, diabetes is probably the most common?
Diabetes, hypertension, I would say that it depends on the locality. Most of the low-income countries is either one of them is above the other, either number one, number two. So you are just looking at
between diabetes and hypertension. But they go hand in hand.
They go hand in hand. So one can end up giving you the other two.
Is it possible that there are cases where a patient is going through all two?
Yes. Oh, yes. Very common.
Hey, you need
double trouble.
You need intervention. You need divine.
Very, very common. Yes, that you can have. You can be diabetic and also be
Which one triggers the other?
It depends which one came first. It could be that, okay, the person was diabetic, and then as a result of the complications because of poor control. So you see, once you are diabetic, you need to be able to control it. People think that, okay, once I'm diabetic, I will, well, just take the medications for a few, months, and that'll be it. But no, it's a lifetime thing. You need to be able to take your medications. You need to be very compliant with your medications. Aside being compliant with your medication, it comes with some lifestyle modifications as well. Very important, so that you can control it. It's well controlled. But if it's not controlled, it means that you do take the medications as and when you like it, and then certain times, you eat whatever that you want to eat as well. You don't have any diet restrictions. This will then continue. The whole process will continue, affects your vessels, and then affect your heart, and eventually you may end up with all of these complications that we talk. They are very dire complications. Retinopathies, where it can even affect your eyes. Some people may end up, you have blurred vision, and then in the extremes, you may end up losing your sight. And then when it comes to nephropathies, even your kidneys can affect your kidneys as well, where you may end up with some complications of kidney health, and then eventually you may end up with some end-stage renal disease and all of that. So it says diabetes in general is a metabolic disease, but that metabolic disease is made up of what? Substances. So these substances, the hormones that we are, and it affects multiple organs within the body. Multiple organs within the body. And that would affect the metabolism of the whole human being in general. You get it? So it is actually a very serious condition that we don't have to joke with at all.
So once you get it, there's, like, it can't be cured.
No.
You have it for the rest of your life. It has to be managed.
Especially, type 2. It has to be, you have to make sure that you are managing. So you are managing. Some people, well, it may reduce a little bit in terms of its severity, if it has to do with what the lifestyle modification. So now I'm incorporating a few more of fruits and vegetables in my diet. I am exercising. I am avoiding all the things I'm supposed to be avoiding. In certain times, when you do have pre-diabetes, so pre-diabetes is, let's say you have sugar levels. So you are not diabetic. One leg is you are not. The other leg is the other.
Look, I was about to ask. People say I have high blood sugar, but I'm not diabetic.
Exactly. So then, let's say if you have sugar levels of between 5.7 to about 6.9. Okay. So in that state, you are not really diabetic.
Okay.
But it's something we call pre-diabetes. Okay. So you have higher chances of what? Crossing over to become diabetic.
Wow.
Okay, so in that state, yes, in that state, you need to, if you take your lifestyle modifications very seriously. Some people stay in there and they don't end up crossing over to become diabetic, okay, because they've started and they've lost some weight, okay, because obesity is also one of the risk factors, okay, and then in that sense, they don't cross over to become diabetic. But once you become diabetic, and you're on treatment, it's a lifestyle, it's a long term management that you need to go through, depending on what you be giving, either some insulin replacement or you may be given some oral hypoglycemics, depending on what you do have. And
from you, we are told that it is also, type 2 is the most overwhelmingly common one.
Yes, yes.
Well, like what, 70%?
So you will say yes, it's greater compared to the type 1.
The type 1.
So that's
and it's mainly a sedentary lifestyle, right? So
yes,
you live in a high-rise apartment, no trees.
Exactly. People are not
from the aircon in your apartment to the aircon in your car.
Exactly.
To the aircon in your office.
Exactly.
No breathing space.
No exercising. People don't take walks. People move from, and sometimes I ascribe it to the fact that it's the work demands. Some people just move from their homes straight to the offices through a vehicle. They sit throughout. They take maybe short breaks just to have some meals, and then they go again, the same thing. So the routine starts, and they do this for 5 days in a row, 6 days in a row, you know, without making that intentional effort to have some physical activity. It's recommended that at least you should have about 30 minutes of exercise for 5 days within the week. So that's about 150 minutes of exercise. And that exercise should be up to the level of what's perspiration. So you should in that 30 minutes, I should sweat. Then I know that I've done what is expected of me, you know. So yes, it's as you are mentioning, it has to do with the kind of work that we are doing now, and also people not being intentional about what goes into their body, and whether they are having some physical activity within the week or not, and that is very, very important.
Is it hereditary?
So there's some family incidents where if you do have, let's say you have a first degree relative having diabetes, you have the chance, you have a greater chance of developing diabetes as well. So it runs in the families. So if especially, it's important you brought it up, because especially in a family where you know that, okay, my mom or my dad was diabetic, then you have the chance, you have higher risk of developing diabetes if you don't start checking early. One, if you are not restricting your diet, if you are not indulging in physical activity, it means that you can easily also develop, your risks are higher compared to somebody who does not have any family history at all of diabetes. Yeah, so it's important that such people watch it very early, and they start taking into consideration all the precautionary measures that there is, so that they don't end up developing diabetes as well.
Does pre-gestational diabetes in pregnant women,
yeah,
does that also stay with you even after you've given birth?
No. So pre-gestational diabetes has to do with you developing diabetes during pregnancy. Okay, so it's important, yes. So that's why
how does that even happen?
So it has to do with the hormones. So the hormones that are produced by your placenta during pregnancy interferes with how sensitive the insulin that I mentioned earlier is in the body of the pregnant woman. So it reduces its sensitivity. So it means that now that the insulin is being produced, but it's not doing the work it's supposed to do. So she ends up having a lot of the sugars or the glucose within the blood, and it's not going into, and then eventually she develops gestational diabetes. Okay, so that the diabetes that that starts during pregnancy, we'll call that the gestational diabetes. And usually after birth, it stops, or that's the end of it. But that woman has the chance of developing type 2 diabetes, has a greater risk of developing type 2 diabetes. And then also, some of them may end up, even in their next pregnancy, also developing that, which will put her at risk and puts the baby also at risk. So in such patients, you need to be able to monitor for a very long time, and then also the lifestyle modifications should come in handy in such patients as well. Because sometimes it becomes routine. Oh, I'm pregnant, so I'm producing a lot of urine. I'm eating a lot. We think, okay, it's part of it. But then it's very mandatory now. If you are pregnant, you have to have your sugars checked in fact, almost at every visit. And then usually in your first trimester. Okay, and then it moves on to your second trimester. Very, very important. Otherwise, you end up putting the baby at risk and then putting yourself also at risk. But people who are diabetic can give birth to healthy babies. That shouldn't, we shouldn't be prejudiced that once you are diabetic, you're going to give birth to an abnormal baby. No, not at all. You can be managed, it can be controlled, and you will be able to give birth to a healthy baby without any complications.
What treatment options, or let me call them management options, are available?
Yes, so depending on the type, and then also depending on how high your sugars are. So if you are admitted into the hospital and you have to be managed for diabetes after you have gone through all these investigations, the most important is that you would want to control the sugar levels. So there are insulin replacements that you can give. So from soluble insulin that is titrated and given over a period, and that will help you to calculate the amount of, there's another one that you can give, the Mixta. That is also another type of insulin that you can give. That is also available. So usually it's subcut injections that you could be given. So those are the insulins that could be given. Coupled with that, you can have some oral hypoglycemics as well that you could be given. So these are medications that you would swallow, and then with time you'll be checking your sugars, and then it can be titrated. There are different types of them. It will be titrated based on the individual till you get well glycemic control for that particular individual. So it really depends on that. So those are the treatments that are, in a nutshell, that is available. But there are other treatments that are also available for the complications that may happen. So if you do have, let's say, a gangrenous, or you do have a gangrenous limb, then it means that depending on where it has reached, there are surgical managements for that as well, where you would have to take care of whatever that is gangrenous before you would you would have to take care of the glycemic control, make sure that it's well controlled, then you would take care of the complication that has already happened. And if it has to do with your kidneys as well, you need to go through renal function tests. And then based on that, you would be given certain medications or treatment for that as well. So the message here most of the time has to do with the fact that please know your numbers, make sure you're checking your sugars as much as possible, and don't wait till you have complications or you suffer complications, because these complications can be very, very dire to the patient. Imagine if you have complications to the extent that it has gotten to let's say it's affected one of your limbs and you would have to undergo an amputation of some sort. Because of the nature of it and how it affects your nerves, sometimes some of the lifestyle modifications would be that you have to wear very loose footwears, okay, footwears that are comfortable, footwears that would not constrict your foot, and also footwears that would not predispose your limbs to any injury, okay, because of the fact that you may end up becoming a little insensitive when it comes to any of these little injuries that may happen around you. So that is where some of these things do happen. People wear footwears that are not comfortable, then they end up getting some injuries or little cuts that they don't even recall. They can't perceive that they have those injuries. By the time they realize it has become a very huge ulcer, and managing it becomes very difficult. Yeah, as much as possible.
Doctor, thank you so much. I mean, very valuable insights. If this doesn't scare you to get up and be active, then I don't know what will, because, wow. I mean, if you get it for life, right? And you don't want that to happen to you.